Hi everyone. Welcome to the free webinar Care for All, organized by the 4 Dimensions Consulting Limited. I'm your speaker today. My name's Angel, the clinical psychologist at 4 Dimension. Not sure if 4 Dimension Consulting Limited is new to you yet. May I take this opportunity and spend a few minutes to introduce my company. 4 Dimensions Consulting Limited is a private limited company set up by Hong Kong Christian Service. We are the first employee assistance program provider in Hong Kong since 1991. We offer total solutions to assist employees with work-life issues, develop strength and potential, increase work engagement and positivity at work, with ultimately enhance organizational excellence and sustainability through mainly 5 services, including work-life information, professional personal counseling and consultation, coaching, wellness program, and critical incident stress management. We are a team of widely acclaimed professionals with master degrees in social work, counseling, clinical psychology, occupational psychology, training and management, etc., providing excellent EAP services to over 1,000 local and multinational corporations with over 1 million working individuals and their dependents. If you're interested in our service, please contact us directly. We're happy to provide you with more information. Okay, so back to our webinar today. In the following 40 to 45 minutes, I'm going to walk you through this listed content in the slideshow. I'll firstly briefly introduce you to common mental health disorders, namely depression and anxiety disorder. You'll be able to know the diagnostic criteria of the 2 mood disorders and the 2 instruments or questionnaires for screening and measuring the severity of depression and anxiety. After sharing some hard knowledge, I'll present you an action plan for Care for All with 3 steps, including the first step, identification and assessment of risk of suicide or risk of harming others. Some do's and don'ts when supporting those mental health issues by communicating and listening non-judgmentally. And finally, the last step, how to assist and encourage help-seeking behaviors. Alright, before I talk about mood disorders, I'd love you to ask yourself, how are you feeling? If I give you a scale of 1 to 10, with a score of 10 indicating the bad state of your mental health, and 1 representing the worst state of your mental health, how would you rate your current status? What contributed to this score? According to the World Health Organization, mental health is a state of mental well-being that enables people to realize their ability, cope with the stresses of life, learn well and work well with productivity, and contribute to their community. It is an integral component of health and well-being that underpins our individuals' and collective abilities to make decisions, build relationships, and shape the world we live in. Although most people are resilient, people who are exposed to adverse circumstances, including inequality, violence, disability, etc., are at higher risk of developing a mental health disorder. So, what is a mental health disorder? Mental health disorders such as depression and anxiety may develop as a result of chemical imbalances in the brain that affect your thinking, feelings, mood, physical condition, and behavior. It usually associated with distress or impairment in important area of functioning. So for instance, a patient with depression may think negatively, experiencing sad emotions often, quitting all interests he or she used to have and have trouble sleeping, etc. While a person with anxiety with a lot of worries in mind, feeling anxious, experience shortness of breath, and having difficulty concentrating. So let's talk about depression in details. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Depression in clinical terms, we call it major depressive disorder, MDD. So the Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition, written by the American Psychiatric Association, we call this book DSM-5, is the most important resource for diagnosing mental health and brain-related conditions among clinical psychologists in Hong Kong. While psychiatrists in Hong Kong use another manual named International Classification of Diseases 11th Revision, we call it ICD-11, developed by the World Health Organization. I'll share the symptoms of the mood disorders based on DSM-5 in today's webinar. As you can see on the screen, major depressive disorders, MDD, cause a persistently low or depressed mood and a loss of interest in activities that once brought joy. That's the pink circles that I just mentioned. Besides, you can look at the purple circles as well. The persons who are experiencing depression may have increased or decrease in appetite, which may result in weight changes. He or she may have trouble sleeping or sleeping too much. For psychomotor agitation, patient may not be able to stay still or remain calm. Vice versa, they may speak slowly with decreased movement, and we call it retardation. Decreased concentration, feeling worthless or excessively guilty, having low energy or fatigue are possible symptoms of depression as well. What I would like to highlight here is the recurrent suicidal ideation. A person of depression may think of death and suicide from time to time, and we'll discuss more in the next part about how to identify and assess those risk cases. People experience the symptoms do not mean they will be diagnosed with MDD directly. According to DSM-5, MDD will be diagnosed when 5 or more of the symptoms have been presented during the same 2-week period of time and represent a change from previous functioning. And at least one of the symptoms is either those I highlight in red or pink circle, which are the depressed mood or diminished or loss of interest or pleasure. To have a quick assessment of whether you might have signs and symptoms related to depression, you can try to complete the Patient Health Questionnaire 9, PHQ-9. It is one of the tools used to screen for the presence and severity of depression and to monitor response to treatment. May I invite you to take this test together with me now? Please prepare pen, pencil, paper, or just simply use your phone to mark down the answers of each question. This questionnaire has a total of 9 questions, and it will be a short one. And please rate on a 4-point scale ranging from not at all, that you can score 0, several days, 1 point for that, more than half the day, 2 points, and nearly every day. Use the scale to rate the frequency which you have experienced certain problem listed in the questions in the previous 2 weeks. So ask yourself, over the last 2 weeks, how often have you been bothered by any of the following problems? Let's do it together, huh? First, little interest or pleasure in doing things. Second, feeling down, depressed, or hopeless. Third, have you been troubled or bothered by trouble falling or staying asleep or sleeping too much? Fourth, feeling tired or having little energy. Fifth, poor appetite or overeating. Sixth, feeling bad about yourself or that you are a failure or have let yourself or your family down. Seventh, trouble concentrating on things, such as reading newspaper, watching televisions, or even concentrating in this seminar. Second last, moving or speaking so slowly that other person could have noticed. Or the opposite way, being so fidgety or restless that you have been moving around a lot more than usual. The last question. Thought that you would be better off dead or off hurting yourself? So after completing questions, please add together the scores to get a total scores. So add the scores of the 9 questions together, sum it up, get the total score, and I'll show you the interpretations in the next slide. So as you can see from the table, a total score of 5, 10, 14, and 19 represent cut points for mild, moderate, moderately severe, and severe depression respectively. For those who score between 6 to 10, you're under the mild severity level depression. And it is reminded that you should be watchful of symptoms and measure again from time to time. For those score between 11 to 14 with moderate grade of depression, you can consider psychotherapy and medications to handle the symptoms that you're experiencing. And for those score 15 or up, you're under moderate, severe, or severe level of depression. Please do consider immediate initiation of treatment or even approach us, the EAP service. Please note that no test is 100% accurate. No matter what your score is, you're encouraged to seek help if you have any concern about yourself and your loved ones. Okay, after talking about depression, let's move on and talk about anxiety. Occasional anxiety is a normal part of life. Many people worry about things such as health, money, family issues, relationship problems, etc. But anxiety disorder involves more than temporary worry or fear. For people with an anxiety disorder, then anxiety does not go away and can get worse over time. The symptoms can interfere with daily activities such as job performance and relationships. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, and various phobia-related disorders. And we will focus on generalized anxiety disorder, GAD, today. So again, I share with you all the symptoms based on the DSM. The person must have excessive anxiety and worry about a number of activities or events. For instance, work, performance, relationship issues, etc., occurring more days than not for at least 6 months. Besides, people who found that worries are difficult to control and must have associated with 3 or more of the symptoms listed in the orange circles, which are fatigue, muscle tension, irritability, restlessness, or key up or on edge feelings, disturbed sleep, and difficulty concentrating. In order to perform initial screening tool for generalized anxiety disorder, you may refer to Generalized Anxiety Disorder 7. We call it GAD-7. It is a 7-item instrument that is used to measure and assess the severity of generalized anxiety disorder. Very similar to PHQ-9 that I just shared minutes ago, each item in GAD-7 asks the individuals to rate the severity of his or her symptoms over the past 2 weeks. Response options include none at all, survey dates, more than half days, and nearly every day. If you would like to know about your anxiety level, please spend a few minutes here and complete the questions together now. Ask yourself, over the last 2 weeks, how often have you been bothered by the following problems? First, feeling nervous, anxious, or on edge. Second, not being able to stop or control worry. Third, worrying too much about different things. Fourth, trouble relaxing. Fifth, being so restless that it is hard to sit still. The second last, becoming easily annoyed or irritable. Last one, feeling afraid as if something awful might happen. So after completing all the questions, now add together scores to get the total scores. And I'll show you the interpretation table. You can see score of 5, 10, and 15 represent points of mild, moderate, and severe anxiety respectively. If you score between 6 to 10, please be watchful of symptoms and measure again from time to time to monitor your level of anxiety. Those who have a total score between 11 and 15, please consider psychotherapy and medications to handle the anxiety symptoms. For severe anxiety, with score between 16 and 21, immediate initiation of treatment is suggested, and you may need support from the professional help when necessary. So after knowing the hard knowledge of mood disorder, let me talk about action plan in order to achieve care for all. I'll summarize the plan into 3-step ALA, which stands for first, A, assess risk of suicide or harming others. Second, L, listen and communicate non-judgmentally and give support. And lastly, A, assist in encouraging help-seeking behaviors. Suicide is a complex and tragic phenomenon that affects individuals, families, and communities. Recognizing the warning signs can be crucial in providing timely support to those in distress. So here I'm going to present you, some common warning signs of suicide. Behavior-wise, one of the most alarming warning signs of potential suicide is when an individual begins to make preparations for their death. This can manifest in various ways. They may start organizing their life insurance policies, check with bank accounts, arranging the property arrangements, etc. These behaviors indicate that they are planning for a future without themselves in it. They might reveal beneficiaries on life insurance or wills, which suggest a preoccupation with their mortality. Another significant sign is when a person starts giving away cherished items or personal belongings to friends or family members. This could include pets, precious souvenirs, or other meaningful possessions. Such actions often reflect a belief that they will not need these items anymore and can signify an emotional detachment from their current life. Expression of suicidal thoughts are also crucial, a critical indicator that we should never be overlooked. Phrases like, "it's better to die," or "someday if I'm not here," are explicit indication of suicidal ideation. This statement should be taken seriously as they reveal the individual's feelings about their existence and hint at possible plans for self-harm. In addition to spoken words, written communication, such as notes or messages, posted on, social media, or even, you can see notes, books, on the notebook, can also convey suicidal intentions. It's essential to pay attention to any writings that express hopelessness or despair. Sudden shifts in behaviors can serve as a red flag for suicidal risks as well. For instance, a marked change in personality, such as increased irritability, withdrawal from social interactions, or loss of interest in previously enjoyed activities, can indicate underlying mental health issues. Significant changes in appetite, whether or not it's increased or decreased in sleep patterns, which can be insomnia or hypersomnia, are common symptoms associated with depression and anxiety disorder. A noticeable decline in work productivity at work, if you can see, colleagues is having, experiencing these, might signal that an individual is struggling emotionally. This deterioration often stems from overwhelming feelings of sadness or hopelessness. Engaging in reckless behaviors, substance abuse, or other unusual actions can also be indicative of someone who is experiencing severe emotional distress. So that's the behavior we can observe. In terms of emotions, when an individual expresses feelings such as no one would help me in this world or there's no way out, they are articulating profound helplessness. These statements reflect a belief that their situation is unbeatable, that they are isolated from potential support networks. Another type of statement, such as things go worse because of me, highlight another critical aspect of suicidal ideation. That's the guilt and self-blame. The experiencing these emotions often internalize negative outcomes and believe they are responsible for their sufferings or the suffering of others. This self-blame can exacerbate feelings of worthlessness and contribute to a cycle where the individuals feel increasingly trapped by their perceived failures. Phrases like tomorrow would not make any difference can contain deep-seated meaning that there is no hope for improvement or change. This sentiment reflects an absence of optimism about futures and can be particularly dangerous as it suggests that the individual sees no reason to continue living. The perception that tomorrow will bring nothing but more pain can lead individuals down a path towards considering suicide as a solution. So, how we assess individuals who may be experiencing suicidal thought or behaviors? When speaking with someone who might be at risk, it is important to ask direct questions about their CPR, which stands for C, current plan, P, prior behaviors, and R, resources. For current plan, you might begin by saying, do you think of suicide or harming yourself when you're under tremendous stress or feeling very sad? This question opens the door for them to express their feelings without judgment. You can also follow up with, are you thinking of hurting yourself now? What is your plan? This inquiry helps clarify the seriousness of their thoughts and whether they have formulated any specified intentions. Additionally, you can ask, do you consider doing it? By what means? These questions aim to understand if they consider methods for self-harm, which can indicate the level of risk they may be facing. Remember, the more concrete the plan, the higher the chances of suicide. Secondly, understanding past behaviors can provide insight into individuals' current mindset. You could ask, have you ever attempted suicide before? What was the reason? This question allows them to reflect on previous experiences that might still impact the current feelings. It also shows that you care about their history and want to understand their struggles better. Again, individuals with previous suicidal attempts indicate a higher chance of suicide. As for resources, it's equally important to discuss what keeps them anchored in life. You may say, what makes you feel like you wanted to leave? This question encourages them to identify positive aspects of their life or support systems that provide hope. Furthermore, you can ask what makes you think about that less. This helps uncover coping mechanisms and activity that distract them from negative thoughts and promote mental well-being. We shall make use of these protective factors by reinforcing them during the conversation. By asking clear questions about their current thoughts, past behaviors, and resources for coping, we can foster an open dialogue that might lead them towards seeking help. Don't forget, your willingness to listen and engage can make a significant difference in someone's life. Here comes the second step of the action plan. L. Listen and communicate non-judgmentally and give support. I'll share some do's and don'ts while talking to those with mental health issues. The do's: when initiating a conversation, body language plays a crucial role in establishing rapport and make the other persons feel comfortable. Here's how to effectively use body language to start a conversation. By sharing with you the acronym SOFTEN. S stands for smile, so try to have a genuine smile. It's one of the most powerful tools in nonverbal communication. It conveys warmth, friendliness, and approachability. When you smile, it signals to the other person that you are open to interactions and interested in engaging with them. Research shows that smiling can trigger positive feelings in others, making them more likely to respond positively to your overtures. O. Open posture. Adopting an open posture is essential for effective communication. This means to avoid crossed arms or legs, which can be signals of defensiveness or disinterest. Instead, keep your arms relaxed at your side. Use gestures that invite engagement. An open gesture not only makes you appear more approachable, but also encourage the other persons to feel safe and willing to engage in conversation. Lean forward. Leaning slightly forward during a conversation indicates interest and attentiveness. This subtle shift in posture shows that you're engaged and eager to listen. It creates a sense of connection between you and the other person, and it demonstrates that you value what you have to say. However, it's important not to lean too far forward, as this can invade personal space and make the other person uncomfortable or even feel scared. The tone of your voice is just as important as the word we chose. A warm, inviting tone can set up the stage for positive interactions. Varying your speech and volume can also help maintain interest. Speaking too monotonously may lead to disengagement. Additionally, using an enthusiastic tone when discussing topics of mutual interest can foster excitement and encourage further dialogue. For eye contact, it's good to maintain appropriate eye contact as it can help establishing trust and connection during conversation. It shows that you're focused on the other person you're talking to and value their presence. However, again, it's important to strike a balance. So just not have too much eye contact. It can be perceived as daring or aggressive, while too little eye contact comes off as disinterest or insecurity. Aim for steady and natural eye contact throughout the conversation. Not a name, nodding occasionally while listening reinforce that we are engaged in conversation and encourage the other person to continue sharing their thoughts. And using the person's name helps personalize the interactions and foster a sense of connection. It shows respect for their identity. You can then feel valued within the conversation. That's the body language. And for the content of the conversation, the second tips is to start it with open-ended question, which invite the individuals to share their feelings. For instance, seeing that you look tired today, is everything all right? Opens the door for them to discuss any underlying issues they may be facing. These questions not only acknowledges their appearance, but also shows that you're attentive and genuinely concerned about their well-being. It is also appropriate to address physical concern of the individuals at the start of the conversation. For instance, you may say, "You didn't sleep well," or "You looking well. Do you need to see a doctor?" These questions not only acknowledge your observations, but also invite them to elaborate on stressors or lifestyle factors affecting the rest, followed by gently suggesting them to seek professional help. The third tip that I would love to share is active listening. It is an important communication skills that foster understanding and connection between individuals. One effective approach to enhance active listening is through the concept of the golden dialogue ratios, which suggests a speaker to helper ratios of 7 to 3. This means that in a conversation, the speaker should ideally talk for 70% of the time, while the listeners or the helpers engages for 30% of the time. This balance allows for an open and safe exchange where feelings can be expressed and understood. The speaker should feel encouraged to express the event and emotions fully. They might discuss situations that have caused stress, depressions, or feelings of shame. The listener's role here is to provide an attentive ear without interruption, allowing the speakers to articulate the narrative completely. The listeners can summarize what has been said, reflect back feelings, and ask clarifying questions that encourage deeper explorations of emotions. Lastly, remember to show empathy and care during conversation through reflecting and clarifying the speaker's point. When we engage with someone who is struggling, it's good to acknowledge the complexity of their situations. A statement like, "Although I cannot know exactly how you feel, I understand how difficult this must be for you," emphasize while we may not fully grasp their emotions, we would recognize the weight of their struggles. You might also recognize and assure the positive intention behind their actions. For example, saying, "I know you're trying your best," serve as a reminder that effort matters. It assures them that they're not alone in their struggles and that their hard work does not go unnoticed. Such affirmation can foster resilience and encourage them to continue pushing forward despite the challenge they face. Finally, it's crucial to convey a willingness to support them actively. Phrases like, "I'm here for you," or "We all need help at times like this. I'd like to help," communicate a readiness to stand by them during difficult moments. These statements create a safe space where individuals feel comfortable reaching out for assistance without fear of judgment. Going through all this, let's discuss about behaviors to avoid. One of the most detrimental actions when speaking with someone facing mental health challenges is to blame, judge, or criticize their feelings. Statements like, "You shouldn't think like this," or "Don't cry," dismiss the person's emotions and can exacerbate feelings of shame and inadequacy. It is essential to recognize the negative thoughts and emotions of daily experience for those struggling with mental health. Another common pitfall is the tendency to jump straight into problem-solving mode. Phrases such as, you should do this instead, may come off as dismissive of a person's current emotional state. While offering solutions may stem from a desire to help, it often overlooks the needs for empathy and understanding in the particular moment. Thirdly, while sharing personal experiences can sometimes foster connections, using one's own story as a teaching tool can be counterproductive. Statements like, I've the person, I've experienced the same before. I'm a person who actually go through exactly what you are going through, may unintentionally shift focus away from the person's unique experience and create a sense of competition and suffering. Each individual's journey with mental health is distinct and unique. Thus, it is vital to prioritize their narrative over our own experience. Minimizing someone's struggles by saying things like, it's no big deal, just be strong, can invalidate their feelings and lead them to feel isolated in their pain. Such comments imply that they should simply overcome the issues without recognizing the complexity of the mental health challenges. Finally, making diagnosis or judgment about another person's emotional state, such as you're crazy, you must have some depression or some kind of psychiatric problems. Just go to the psychiatric hospitals and stuff. It's very harmful and stigmatizing. This behavior not only undermines professional assessment, but also perpetuates stigmas surrounding mental health condition. It's good to refrain from labeling others and instead encouraging them to seek professional help if needed. It's important to assist and encourage the individuals to seek help from professionals in the long run, given and especially if the case is at risk and you can identify he or she got suicidal ideation and a severe level of the common mental health disorders. So after initiating the conversations and with some brief assessments, some brief observations, how we can prepare for the case referral. There are 4 steps we can help making referrals. The first step is to identify the specified problems that an individual is facing. This requires the skills that I've mentioned earlier, such as understanding the problems, encountering, risk assessment, active listening, showing empathy, etc. By pinpointing the exact nature of problems and the potential consequences, we can tailor the referral process to meet the individual's needs more effectively. The next step is to explore available resources that can provide assistance. This includes identifying local services such as the psychiatric and medical service, counseling center, support group, healthcare providers, or community organizations that specialize in addressing similar issues. Researching these resources ensures that we have accurate information about what the organizations offer and how the helping professionals can help. It's also beneficial to consider online resources or hotlines that individuals can access for immediate support. Encouraging individuals to accept help from others is a delicate yet vital part of the referral process. It's important to communicate that seeking help is a sign of strength rather than weakness. Providing assurance and normalizing their feelings can make them more receptive to accept assistance. Additionally, obtaining consent before making any referrals respect their autonomy and foster the trust in our relationship with them. We might say something like, I believe these resources could help you. Would you be open to me connecting you with them? Finally, once consent has been obtained, it's time to connect the individuals with the appropriate resources by arranging sections or meetings. Providing concrete details such as date, time, locations, and contact information helps eliminate barriers that might prevent the individuals from following through on our referral. Clear communication about what they can expect during the sections will also help alleviating anxiety and encouraging participation. Last but not least, here are some resources in Hong Kong with 24 hours hotline that I would like to share with you. For instance, our company, For Dimensions Consulting Limited, we provide 24 hours counseling and consultation hotline with helping professionals picking the call directly for our EAP clients. There are also 24 hours hotline offered by the government, including the Social Welfare Department, Hospital Authority. And there are some other helplines set up by different organizations that you can take a look. Besides hotlines, there are other mental health community resources, including websites and mobile apps that you might be interested in. There are some apps with online tests, some screening tools. There are some app and chat service that you can maybe text directly to the helping professionals and ask for help. So you can also take a look at these resources too. Last but not least, creating chances for self-care and caring for others within our daily routines serve as a start of care for all. We can set aside time weekly to connect with friends and family members. Organize gatherings from time to time, such as some family dinners during festival. Have you participated in some gatherings on Mid-Autumn festivals early this week? Besides, we can celebrate achievements with ourselves and those we love. We can also engage in community activities by, let's say, volunteering and participating in some mental health workshop like this to increase our mental health awareness. Creating chances to take care of ourselves while also caring for others is fundamental to build healthier individuals and communities. By recognizing the significance of both aspects and actively seeking opportunities within our daily lives, we contribute positively not only to our own well-being, but also enhance the lives of those around us. So that's what I want to share with you all today. Please feel free to type your questions in the chat room if you have some in mind, or even if you're interested in our EAP service, you can take a look by calling us, or take a look at the website, or email us. All the contact details are listed on the slide. So I'll be here, for a few minutes more. And if I've received I don't receive any questions, then I'll cut it an end. Thank you for participating in our webinar today, and have a great mental health day.